Good morning, everyone. Thank you and welcome to the CareSouth Carolina Community Live podcast. I am your host, Mark Calhoun. I'm the Director of Social and Community Services for CareSouth Carolina with my partner in crime.
I'm Daniel Myers. I'm the Director of the MAT SUD program for CareSouth Carolina. Hey, everybody.
All right. So we have a very, very special show for you today. This is Community Health Center Week. It's one of the most special weeks that we have in the community health center world. This is an opportunity for us to celebrate community health centers across the nation, celebrate our patients, celebrate our staff. And what we have today is two special ladies that we wanted to bring on today. So I'm not going to talk about them. I'm going to let them introduce themselves and let them tell you a little bit about themselves. And we'll start with Miss Carolyn.
All right. Thank you for having me. I'm glad to be with you today. My name is Carolyn Emmanuel-McClain. I'm the CEO of Rural Health Services in Aiken, South Carolina, where I've been for the past 10 years or so. And I came there from Orangeburg, South Carolina, where I was the CEO of the health center there for 15 years. Also did some work with the association for 2 or 3 years as a consultant in other health centers. And actually started in North Carolina, right across the line there at that Robinson Healthcare. I started the what was back then called the Pembroke Medical Services, and then changed to the Lumbee Health Center, and now is Robinson Healthcare Corporation. Wow. So I was the founder of that health center and started that, and came across the line and joined the folks over here and the good work they've been doing for the past 30 years. This is where I've been.
Wow.
I have served a stunt during that time as chair of the National Association of Community Health Centers back in 98, 99, 2000. A couple stints of chair president, I think back then, of the South Carolina Primary Healthcare Association. And that's pretty much what I've done throughout my health. All I know is health centers. The only thing done. You can look at Ann and I both when you talk about our number of years. At our age, that's the only thing we could have done, and we started at a very early age, and you'll be able to
Hey, folks, this is really cool. This is a live podcast. What fun. Marek and Daniel really have it going on. It shows up on my screen kind of like the old Brady Bunch format. So, where somebody's in the little square. So it's going to be fun today. As Marek said earlier, this is a very special week for community health centers across the nation. It is Community Health Center Week, and we are always so excited to really celebrate the legacy for community health centers. As you see, I am the CEO of CareSouth Carolina. I haven't had a very extensive past in community health centers. I've just been at CareSouth Carolina for 40 years. It's the only place I've ever been in the community health center world. We started out as a very small organization. We were actually called back in 1980 Society Hill Family Health Clinic. We grew a little tiny bit and we became PD Community Health Services. And then in 96, we moved on to another new name, CareSouth Carolina. Now we're a pretty large organization. We have 570 some odd employees, and we're in 14 locations across the PD area in South Carolina. We are really proud to stand shoulder to shoulder with community health centers, of which Carolyn leads one in South Carolina in this very special week. Thank you for having us.
Absolutely. And one thing folks don't know about community health centers, we're a tight-knit group. We're like a family. We could bicker sometimes and we can have fun sometimes, but at the end of the day, we got each other back, right? And we can argue amongst each other, but you better not come in and mess with us.
That's right.
That's right.
Carolyn, you probably know a lot of the history of community health centers.
And the good thing about health centers, before we get into that history, Marika, I want to comment, piggyback on what you just said. Not only you don't mess with us, but if we need each other, we call. Just a couple of weeks ago, I called and it says, "Look, I've got someone from your area that's calling me. Want to know where can they get a COVID test?" And they've been all over and they don't know what to do. And Ann says, "Well, let me tell you, let me call this center and see if they've got a test on hand." And I call this whatever, and I call you back the next morning and let you know. And she did. If there's something that Pam and Little River has, something that Ann has, something Regina has in Greenville that I need, I'll call them and say, "Look, do you have this? Have you seen this before? Will you share this with me?" And we share. And so we are a true network of community health centers. As far as the history of community health centers, they started back in 1995 out of the civil rights movement. And Count Geiger Gibson was actually from South Africa and was doing some studies over there. And he, over in Africa at that time, they had what was called neighborhood health centers. And he saw that model and he was looking over here on what can we do? Is there something we can do around that? And it was during the time of the civil rights uprising and everything, and people just really frustrated because they could not get health care. They didn't have running water. They didn't have outside privilege, didn't have any sewer systems. Just folks really hungry, not having much food, not having health care, and not having the means to get it. And so when the community health centers came about, the first one was started by Jack Geiger and out in the one Mount Bayou was the other one, Columbia Point. And then the second one was Mount Bayou. So Columbia Point was like the urban health center. And then the other one in Mount Bayou, Mississippi was the urban. And these health centers got started by people becoming energized and passionate about what it is that they wanted. And they're built from the ground up. These health centers are not built from someone sitting up in an office saying, "I want to build this corporation, and then I'm going to hire these people down here." It's built from the community within. And I say that because the regulations that govern health centers require that the majority of their board of directors be patients of the health center. So those board members, they use that health center. They know what the quality is like. They live in the community. These health centers are built in medically underserved areas, and oftentimes they become that economic engine that employer, and oftentimes that builds that community up, that gives it a foot to get started and employing people and people having an income and starting to grow and develop the community. And those are some of the side parts of health centers. But again, when they got started back in '65, it was a big issue. Some started as just small one-doc shops at that time, just a place for someone to come get their health care, to bring their children to get shots. When they would come in, sometimes that doctor or that provider would write a prescription for food. And Jack Geiger always likes to tell the story about the prescription that was written for someone to get a tractor because they needed to be able to plow the garden to cultivate the food that they could eat. You know, it goes back like, you know, teaching a fish to eat for a lifetime versus feed them, give them a fish and they eat for a day. So it was just trying to develop. There was a lot of community development going in at that time. And these health centers began to spread. And in South Carolina, we have several here that's really been around for a long time. And I know there's a toss-up with who started first, but there was the Federal Health Center and the Beaufort Health Center, Family Health Center, and I think Margaret J. Weston may have been amongst the 4 original health centers in South Carolina. And of course, we go back on history, and you can probably tell some stories about Senator Hollins and Laura Martin, when we used to go to DC and sit in, we call it bars. We were not always drinking, guys. We were there just, we were networking. We were making things happen, but we made things happen in DC for the state of South Carolina, and Senator Hollins was a big part of that.
Absolutely.
And today we can say that carried on that legacy is Congressman Jim Clyburn, who makes things happen for health centers in the nation and makes things happen for South Carolina. He makes sure that we have what we need in South Carolina, and we appreciate that.
Wow.
So
That's
as
awesome.
of today, as of today, we have probably more than 1,400 health center corporations across the nation. We serve pretty near 30 million people. And again, with what we are dealing with this pandemic, this crisis today, we are actually growing. Where people are talking about, well, not many people wanting to come in. That's true, but the ones that are coming in are folks that's never been in before. That's good. I got to have care. I've lost my insurance. I've lost.
Oh, we lost Carolyn for a minute.
There you go.
I'm back.
Yeah,
I'm back.
you're back.
Yeah,
You're back.
I need to.
Yeah.
So that's yeah, and let you tag on, and then if I have to go back and talk more about history, I'd be happy to do so as we
Okay.
carry on.
All right. Out of those 1,400 sites that Carolyn mentioned across the United States, I don't think people realize how large the community health center network is. Out of those 1,400 organizations, there are 12,000 sites. In South Carolina, there's 22 organizations with just multitudes of sites. In South Carolina alone, with the recent data that we all had to submit, we serve 423,000 patients. That's a lot of service that's going on to patients that without a community health center there, they wouldn't have access. They would not be able to afford health care. Community health centers deliver all of our services, and it's not just medical services that we do. We do a wide array of services. We do behavioral health, integrated behavioral health with primary care. We were one of the first large organizations in the nation to really see the benefit of integrating behavioral health and medical care. Dental services are inculcated, alternate care services like chiropractic, even some centers do massage therapy, social services. Both of these gentlemen that you see here today are very strong in that arena. When you talk about behavioral health, you also have to include substance use disorder services, including opioids, alcoholism, things of that nature. So a lot of folks, whenever we start talking about community health centers, they go, oh, I didn't know. Many of us have our own pharmacies, and we're able to bring medications to patients at a much, much, much reduced cost. So I was absolutely thrilled to see an article that was just published a couple of days ago. Forbes, who everybody knows Forbes, they are like the leading economic magazine, so to speak. And they took the time to do an article on the value of community health services. I learned a lot from that article, actually. Do you know that to date, health centers have provided over 8.6 million COVID tests? So it's not only in the primary care arena that we're playing a big role. The pandemic has really been served by community health centers. At CareSouth Carolina, we've really been, we took on that challenge. I think to date, we have provided over 15,000 tests ourselves. And we looked at some data that represented about a little over 2% of the entire state's testing. So we stepped up the entire nation of community health centers to address this pandemic of the coronavirus. So it's we're part of a healthcare system that sometimes, like Daniel said and Marek have said, don't even realize that we're here. We're not only here, we're strong.
Right. That's right.
That's certainly true, Ann. One of the things, like you mentioned about the COVID, I think CareSouth was one of the first health centers to really jump on that and really go at it and start doing that testing without waiting to find out, well, let's let someone else try it and we'll figure out what's going on. No, you just went out there and did what needed to be done. And that was wonderful because it's spread, and there's some, and many, the majority of people that are getting COVID testing are getting it from community health centers, because if they go to the doctor is saying, well, you got to have signs or symptoms for me to do it. But with the health centers, when we're doing these drives, come on in and get your health care, get your COVID test, and without any questions asked. And
or you got to have money.
and we are driven by the community. So as Ann mentioned, all the services that's provided in health centers, that came about because that was a need in our community, and we saw that need. Our community let us know. They presented to us, and we saw that need. It's not that we had to go out and try to figure out, well, what are the needs? We could see the need when the person came to us, so we were able to design our systems of care around the needs of our patients. And the most recent being the substance use and behavior health have been very important services that we've added to our services. When it was once upon a time that one doctor and a nurse, and then as it grew on out, and I believe it was in 2002 when President George Bush, Judge W. Bush decided to double the number of health centers and saw the value in them. And then we had to have what's called the economies of scale. The funding needed to go toward where there was a health center that had at least 3 healthcare providers, I believe, to have a mass of the critical mass, it was called, and not just little docs here and there. And with that critical mass, then they could provide those additional services that was needed. It's difficult to do that when you've only got one doctor. You can't provide all the other services that need to be that you can wrap around a patient that they need.
So in South Carolina, we have 22 organizations that are community health centers. We've been growing in South Carolina. I remember back in 1980 when there was just a few of us and we were trying to organize ourselves into an association, the South Carolina Primary Healthcare Association. It was primarily family health centers in Orangeburg, Beaufort, Jasper, and little old tiny Society Hill Family Health Clinic. But we got the momentum rolling, and there were some ups and downs, so to speak, but we did get the momentum rolling. And now with the Primary Care Association, we're quite a strong organization right now. As we speak, the Primary Care Association is holding its, and I can't remember what year it is. I don't know how many annual they have had, but it's their virtual clinical retreat. I was so excited to be part of that this morning. We awarded 2 of our staff people. Tracy Thigpen, the Chief Nursing Officer, was awarded Nurse of the Year, and Kelly Cross in our Population Health Management. And there was a big turnout. Which just goes to show you, community health centers have become an entrenched part of healthcare delivery in South Carolina.
And as we talk about the growth and how we've grown, Ann, I believe you were the first, you and Wendy Wimborne, one of 2 of you, the first, you didn't have an employee for the association, just the association you called yourselves. And then I believe, was Tom Lucas the first person we hired?
He was our, that was in 19, we didn't get any employee. We had a consultant who was Bill Deck, actually, when grants started becoming available out of HRSA that would actually fund associations and networks and things like that. We actually were able to pool together a little bit of money contributed by various health centers into the association, and we got Bill Deck and Associates then. It was just Bill, and he wrote the grant for us. We got the grant, and Tom Lucas was our very first employee. Now I think the association has 40 or so employees.
It has quite a few. Sure. So there's just been a tremendous growth there.
Yes.
When I was looking back at the history of health centers, just refreshing my memory, again, we talk about how long I've been in healthcare, meaning I got out of graduate school in 79. My professor at that time was a reader of my major paper, Dr. John Hatch, was involved in health centers. And when I was in graduate school, I didn't understand. He called them neighborhood health centers. But John was going over to South Africa to work with Jack on some of those health centers, looking at those neighborhood health centers, and seeing how to come back and do them here. And I had the pleasure of interviewing Dr. Hatch before he passed on a few years ago on behalf of the association. And it was so ironic that I was a graduate student and didn't really know a whole lot. And then I said, gosh, look what happened. I came right out of graduate school, took a job in a community health center. And that's where I've been all my life, and just seeing the value and how this has spread and how important health centers are. And it's important to say that we are the largest healthcare network in the country, primary care network.
Wow.
That's exactly right. You know, people often ask me personally, you know, why are you there? You know, why don't you look someplace else or something? You know, South Carolina is my home. I was born in Dillon, right down the road from Little Rock. And I have to respond to that. There is no other calling that I can think of where service to those, in the case of community health centers, medically underserved, there is no other calling that every single day you, without a doubt, know that you have made a difference in someone's life. And I can't think of any other place that I would ever, frankly, want to work. It's just kind of that simple. We are so blessed.
Yeah, and ditto here. I have some of the same questions. Again, you know, when you put in 40 years, folks, but you could retire. Why don't you just, you know, enjoy life? I said, I'm enjoying life now. I enjoy what I do. I would do what I do if I didn't get paid for it, because that's how passionate I am about it. You know, I'm doing and how more fortunate can we be than to be happy doing what we do, and had rather do that than to be retired and just going wherever we want to go and doing what we want to do. We'd rather be doing this.
Yeah.
And that's a decision that's dedication and passion. And that's what community health centers do to you. It puts that fire in the belly, and it, you know, we've got to ensure, though, as we move on, that we leave that with Marique, with his camaraderie down at the bottom there, making sure that fire is in the belly, and they spread it and keep it going. Because young people that come in now, they come in like, oh yeah, I'd like to have this job, and I can do this and this, and it's a job. No, don't come to work in community health centers because you want a job, guys. Come because you're looking for something to make you happy. And if your heart's in the right place when you come in, you will know it. You will know, hey, this is where I plan. This is where I'm going to be. This is what I enjoy doing. I may leave here, but I go to another community health center.
Well said.
That's right.
Well, you know what, ladies, the community health center got to offer something else too, because you ladies being 18 years old right now and saying that you worked in this thing 30 years. So there must be a fountain of youth, or there has to be some time travel attached to community health centers, because there's no way, you know. So apparently you love what you do, because it doesn't show. It shows, you know, you're vibrant and you're still excited about what you're doing. And I'm praying that whenever I get to where you guys are, that I have the same excitement. I'm pretty sure I will, because I love people and I love helping people. And so I think the best thing that ever happened to me was whenever I got into nursing and my wife introduced me to CareSouth. Whenever I got out the military back in 1995, I think, my first appointment was in Lakeview. And there was a doctor there that really got me. He said, you need to get back into medical school. You need to get back. Dr. Harness. And he was an excellent provider, and he was an excellent guy. He was an excellent person. You know, he really taught me what health centers was all about. It wasn't about the numbers. It was about the person. And he made my appointment so personal that I couldn't wait to go back for my checkups. And so I'm just, you know, and I've been excited about CareSouth ever since then. So thank you.
And that's great. You got the excitement as being a patient. You felt the excitement and the energy.
Yes.
And that's what we'd love to have our staff to do as they go about their their daily duties is knowing, again, at the end of the day, you can go home and feel like, I've made a difference. Because when that person walked out the door that they were happy with the service that they got. Not that you just as a provider felt, well, I made a difference. The patient feels like, hey, someone touched my life today and they've made a difference in my life.
Oh yeah.
In providing this care and providing it with compassion and with dignity. So everyone that walks through the door, regardless of their nationality, ethnicity, their financial standing, we take care of them. We insist upon our staff caring for them as though they were their own family.
Exactly.
So let me ask you this. So the community self health center integrated design, that was by integrated service, that was by design.
Yes, exactly. In the history of community health centers, that we've not always had a very smooth road. That road has often had a lot of challenges from folks that said, well, my doctor's office down the road is much cheaper than what community health centers can do. But the point of community health centers can be summarized in one word: comprehensive. It's everything. It's addressing social barriers. It's making sure that there's transportation, making sure that the patient is served in their language, in at a learning level that they can understand. It really is comprehensive. So we've always met that challenge. And like Carolyn said earlier, community health centers over the years of political turmoil, when there have been challenges here and there, we've always enjoyed bipartisan support because the lawmakers can see that it's not just about having a doctor's office. It's not just about saying your doors are open and here are your four walls. It's really about being in the community, hearing the community's needs, being part of the community, and being comprehensive.
And we have a very stringent quality oversight from the federal government. Our quality program is second to none. They require us to have quality because we're covered under the Federal Tort Claims Act. So again, we must submit data that on our quality, and we examine and we scrutinize to ensure that we have good quality. We're patient-centered medical homes. We are JCO accredited. We have all these accreditations. And we also, when we take care of our patients, when we leave at 5 or 6 or 7 in the evening, that doesn't mean our patient has to end up at ER. They call us. We have a system of care where we must be available to them 24/7. And it's through the hospital, through one of our doctors, or whatever that arrangement is. But we take care of that patient and we're with them 24/7.
Good point.
I know for me, when I started out working in Vantage Point. So in a way, we were kind of sheltered from the health center side of things. So it wasn't until we were attached to the health center there in Hartsville. So I would venture through that door. Sometime it was almost like the lost land. You venture through the door, look, okay, that's what's in here, and so I would venture and start asking questions, and I got intrigued and decided I wanted to come on the health center side of things and just see how it was, and I'm forever grateful for making that decision because I've learned a lot. I've had the opportunity to go into PI to see the broad bipartisan support that community health centers have, and I'm just at awe at every opportunity that I get to go to a conference or network or a meeting and network with other centers, how close knit the system of networking is. It's amazing.
It is amazing.
Yeah.
It is. Marek is referring to Vantage Point. South Carolina made a decision back in the early 90s to kind of expand our menu to become an area agency on aging. Now, this is actually quite unique amongst community health centers, but we have enjoyed having that opportunity, and it brings a dimension of care to combine a community health center and an area agency on aging. And a really good example is that next week we will be taking one of our new mobile sprint vans, we call them Mobies, out to and one of our area agency on aging nutrition sites, and having a round of testing there. So it's a good collaboration, good partnership.
Absolutely.
So there was a question that came in from one of the viewers, and they want to know how can they get involved with an agency like ours, corporation like ours? How can they get involved?
The South Carolina Primary Health Center, and I think Carolyn's might be open. Or you might be getting feedback from me. Are you getting feedback from me?
I'm getting some feedback.
Okay. Yeah, I hear that. Well, to be very quick about this, South Carolina Primary Health Care Association, SCPHCA.org, has a job posting that's there. And if you're interested across the state, you can look at that. If you're interested in the PD, CareSouth-Carolina.com, we also have posting for job openings. Make an application.
That same person said that they are, that they find it wonderful that and that corporations and agencies like ours can get together to help each other, because that's a rarity. It's always competition. It's never a family or a team effort. It's always individual. And they said they find that very, very wonderful that we can get together and help each other. So,
Guys, I have a problem with my vision here. I don't know what's happening to my camera. Can you guys see me?
Yeah,
you're back.
Oh, okay.
Yeah, for a while there, we just heard your voice, but
I'm okay. Yeah, but also posting on Indeed. Health centers use the Indeed posting quite a bit to recruit, as well as our own websites. But if they go through the Primary Care Association website, they'll see a list of all the health centers and can go to each of our websites and see what's open.
I'm sorry. While we're on the subject of recruiting, could you both talk about some of the benefits some of the providers, nurse practitioners, our MDs can glean from being a part of a community health center?
Yeah, but one of the things, if they'd like to join a community health center, is they don't have to worry about the malpractice. They don't have to, again, as we're covered under the Federal Claims Tort Act. And if there's a lawsuit, usually the provider is removed and the Department of Justice becomes the plaintiff of the United States. Again, provided you're doing good quality care, which we're required to do, they don't have to worry about the overhead of administration, et cetera. And they have a large group usually to work with, not only of the primary care providers, but as we discussed before, those wraparound services that patients so often need, that physicians in private practice or in a group practice does not have a mechanism to try to get referrals. We have population health and case managers that work with our patients to get the services that they need, so the doctor can enjoy doing what it is they enjoy doing, which is providing medical care. And then you've got the support staff to help you to do all the other things that the patient needs.
What she said.
And could you talk a little bit about the health service health corps and the benefit of working with that they provide for us providers?
Absolutely. At CareSouth Carolina, the second physician that we employed came to us as a National Health Service Corps scholar. So we have a long history at CareSouth Carolina. The National Health Service Corps has kind of two programs. One is that someone that applies and is accepted can actually be a scholar. And the scholars are actually placed in medically underserved areas, for a period of time. They have to kind of pay back that scholarship. And then the other avenue is the loan repayment. where folks can, and it's a pretty wide array, physicians, nurse practitioners, behavioral health counselors. There's a wide array of clinical professionals that are eligible and their loans repaid, which is a big deal, in return for, the extent of service that's required according to their loan. I think it varies between 2 and 3 years. Um, Frankly, at CareSouth, I can speak for us, we couldn't function without that. I think right now we have 12 or 13 of our provider panel, crossing a lot of different categories, that are receiving a loan repayment. It's a win-win. And it also adds a dimension of being able to recruit folks. Because when we start recruiting and say, oh, by the way, we are an eligible location for you to be able to get your loans repaid, they get real interested real quick.
I know that's right.
Guys, I'd like to go back for just a moment, if I may, on the history. When we first got started, health centers, we were not welcome in every community. As a matter of fact, health centers that were started were required to start in a rural area way out from town, because the medical community would not want a health center coming in around where they were, because they felt it was going to take something from them. Although we were there to take care of people that were challenged, that could not get into healthcare, was our primary purpose, but they just were afraid of us and didn't want us there. So oftentimes we had to set up a site out in a rural area, and that's what happened with rural health services. We had to set up in a little town, and then eventually kind of ease in and build health centers into where the larger populations were that really needed us just as much as the ones in the rural areas.
That's a really good point. When Society Hill started, it was during a period of time that community health centers had to have approval, so to speak, from what were then called health systems agencies. And health systems agencies were frequently, shall I say, commandeered by high-powered local area physicians. And like Carolyn said, they would oppose. And one of our efforts to get the grant at Society Hill approved, we took a busload of community advocates to the health systems agency meeting to make sure that we could shout down the nay voices. And it got a little testy there for a little while, but just exactly like Carolyn said, our road has not been a smooth road in many, many circumstances. We've not always had welcoming arms. We've not always been seen as entities that were, quote, welcome in different communities. But we persisted.
Yeah.
So you bogarted your way in. Now community health centers become a staple of the community. We do I noticed for us, and I know Miss Carolyn, we do a lot of things that go beyond healthcare. We're like you said, like y'all said earlier, we're entrenched in community. We have a place in the community, and we've taken on that responsibility to let the community know that we are here. We are here to stay, and we are with you, and we are one with you.
Well
said. And I want to just talk about where I am right now. I'm at the ladder site, and actually, I walk these hallways as a small child, because this was a school, and I lived right across the field from here. And so, if it hadn't been for CareSouth opening up this building, this history would have died. And so now that CareSouth has brought life into this building, it also brought life into the community. And so now we start to do more events in this building than we've ever imagined doing. But it's because CareSouth was here, and the community trust, knowing that we have healthcare that's going to be here all the time. And I think probably maybe about 3 or 4 years ago, our census was 300. And so now we're way over 4,000, maybe 5,000 people that's coming to Ladder to see us for healthcare. And so think about the growth and, just confidence of knowing that I got a provider right across the street that I can go to, if I'm not feeling well. And so it's personal to me because I can see growth in my community. I can see life in my community because of the healthcare center that's here. So, yeah.
And very seldom do you see a health center close. I mean, very few.
Yeah.
If one closes, it's because they became part of another one in the community there. That care doesn't leave the community. So that's very important that people know. When everything else goes away, that health center is usually still there, serving the patients.
That is a really good point. I'm thinking about over the history in our organization. Whenever there was an opportunity that HRSA offered for what they call a new start, and we would look at our community needs. When we looked at areas like Latta and like Chesterfield, Lakeview, but all of those communities at one time might have had doctors, but they didn't stay. And when we would go to the community, we would say, look, we're here to stay. If a provider comes and goes, we're going to recruit for it. We're never going to just say, oh, well, so and so resigned or, moved to Texas or what have you. We're going to make sure that the community always has health care. That's a very good point.
Wow. This was a great discussion. We learned a lot. We learned the history of community health centers. We understand now that was not an easy road, and to get where community health centers are today, you really had to fight to get to where you are today. I really enjoyed it today. I really did. I want to thank you from the bottom of my heart for you ladies coming on with us today.
Yeah. Marek, I feel kind of pleasure. Like, we in the presence of greatness, and so, and this is the awesome experience. There we go. That's it. Well, thank
you guys for having us. But one of the things I'd like to leave you with is not only did we fight to get here, we still fight every day. We are the voice for our patients, and they have challenges. The voting rights, getting people registered to vote. We're always out there with them. So we constantly fighting to get equality, to get social justice. All that we do.
Right. Fight it over.
That's right. And I do want to point out one thing while we're here: the obvious connection to the Dillon County area, for all four of us, is amazing to be on this. And so before we close out, there's always one question that I like to ask our guests before we leave, and it's nothing to do with healthcare or the job or anything. But what do you ladies like to do on your off days when you want to just kind of exhale? What fun you like to have?
I think
go to the lake.
Yeah, we have something in common. We both
do. You do.
And side and Ann's on the other side.
That's right. Carolyn's on one side and I'm on the other side. I like if I go in the water, great. If I go on the boat, great. But just being around the water, relaxing, that is the best. I'm so blessed.
And that's why we love working with people and serving people. I love that time that I can see the water and I'm kind of alone and I don't have other issues or people pulling at my brain. It just lets me kind of just sit here and unwind.
That's right.
And of course, a glass of wine helps.
Well, we hope to be joining you in a couple of weeks. Me and Daniel's going fishing in Santee, so
yes.
All right.
for a couple of days. So we hope to.
And
We'll pinpoint the location.
Together.
Yeah, I know. Socially distanced.
That's right.
All right. So, ladies, thank you again for joining us. We really enjoyed it. And those out there in Facebook land, if you looking to get in contact with Care South Carolina, you can reach us at www.caresouth-carolina.com, 1-866-498-0399. Miss Carolyn, could you give you guys this information?
Rural Health Services, www.ruralhs.org. That's RURAL, H is in Harry, S is in Sam.org. And our number is 803-380-7000.
All right. All right.
And wherever you are, call. If you're not in my area, I know someone that's in your area that can help you.
Wow.
Oh, well, that's great. All right. Well, thank you again. And everyone, y'all have a wonderful day, a wonderful weekend out there in Facebook land, and we'll be talking to you.
All right. Great. All right. Bye-bye.
Goodbye.
Oh my God, there's